Hey folks, welcome to DocTalk. We're going to have a great show today. Dr. Nora Schrog is my guest. We're going to talk about mastitis in dairy cows. So Bob Steinberger down there in Wichita Falls, Texas, he's told me to get some more dairy on the program. We're going to do it. Thanks for watching DocTalk.
Closed captioning brought to you by Ag Promo Source. Together we grow. Learn more at agpromosource.com. This segment brought to you by Kansas Regenerative Medicine. Your stem cells, your health, your life.
Hey, welcome to the show.
Thanks.
Folks, Dr. Nora Schrog is here today. She's a veterinarian and she has practiced for many years, Nebraska, Kansas, has headed up our ambulatory service here and has done a lot of research. You've done a lot of work with cows, you name it, she's done it, and we're glad to have her here on the show. We're going to talk about mastitis in cows today, and I've had some of the people come in and say, hey, you don't do much dairy, you know, and it relates, dairy and beef and that,
Sure.
but let's talk a little bit about.
Okay, so mastitis doesn't just happen in dairy cows. It can happen in beef cows. So for those of you that aren't dairy people, it does actually pertain a little bit, but some of the specifics will be different. So we'll try and highlight those as we go through. But usually, let's just start about talking about what a cow with mastitis looks like, or how we might tell that. And so on a dairy cow, usually we can tell because we're milking her every day and we're going to squirt out some milk and it's going to have white flecks in it or chunks in it, or it's going to look clear, or it's just not going to look like regular milk.
Gotcha.
And so sometimes the easy way to tell that is the gloves that you use in the milking parlor are sometimes a dark color, so it shows up really easy when you strip them. That can make it easier to find a cow that's maybe not real bad, but is subtly affected. The other thing that changes it is sometimes it's dark down there underneath the cow, so having lights that shine where people can detect it is kind of an important thing.
Absolutely.
But then, so we have several severity levels of it. So we can have subclinical where the milk might look fine, but when they test it for the number of inflammatory cells, then it might be high. Or we can have mild forms where that's when you see a few flecks. We can have moderate forms where we see flecks, but then also if we touch the udder, it's hot and swollen. And then we might also have a severe form, and in a severe form, that means that infection is now not just down in that mammary gland, but it's gone to systemically to the whole cow. And those cows are really sick, and they have a fever, and they're off feed.
And then I'm going to assume that with the different severities and different clinical signs, you start thinking about that original scoring kind of leads you to diagnosis and treatment and things to that nature. So understanding, kind of having a system to grade them is important.
Yeah, it's kind of important to know which category that cow falls in, because that's going to change how we might want to treat her. It's at least one of the pieces of information we use. For the beef guys, you're probably never going to see those mild or moderates, because that calf's just going to go ahead and nurse, and she's probably not going to mind. Maybe a real severe moderate, she might kick at it a time or two. You're probably only going to notice when they get real severe and they just won't let that calf nurse at all, or they're standing there with their head hanging down feeling really sick.
Yeah, and they get that swollen and that hot mammary gland. And so obviously it's more of an issue in dairies. Well, we think it is because the cows are out on the back 40. Right. There's been some pretty high numbers proposed to be thought in beef cattle as well, at least the mild. Sure. But some of the things that obviously when you think about mastitis, what's the first thing that pops into your mind as far as what's causing it?
Usually we think it's a bacteria, right? That's the first thing that pops into my mind, but that's kind of a good point to bring up. We say bacteria, and that's a pretty broad class of organisms. So, we could just kind of, to take it a little different direction and do an analogy, if I said, my yard is terrible and there's something eating it up, I think it's a beetle, or there's something destroying my yard, I think it's a beetle. What would you might
Yep.
think of a little beetle, right? But maybe it's a different type of beetle, and it's like a Volkswagen beetle here, and we've got all different types. So just because we're saying the same name, just because we say it's a bacteria, that doesn't mean that they're all alike. And so we can talk more about those.
Awesome. Well, let's take a break. When we come back, more with Dr. Schrog and her beetle after these messages.
Ag Promo Source is a unique group of marketing specialists with one mission: help your ag business grow. Each affiliate has their own area of expertise, and they work together to bring you advice, products, and services. To get started, visit agpromosource.com. Ag Promo Source. Together we grow.
This segment brought to you by Santa Fe Trail Meats in Overbrook. Visit us online at sftmeats.com.
Hey folks, welcome back to DocTalk. Dr. Dan Thompson here with Dr. Nora Schrog, and we're talking about bugs and beetles and causes of mastitis, and we're glad you joined us today. That's pretty cool.
Well, so now we'll get back on track and get back to those. So yeah, maybe this is one kind of bug, but we're really talking about bugs that cause mastitis or bacteria that cause mastitis.
All right, so let's talk about some of the different bugs or bacteria that cause mastitis.
So there's two big categories that we think of. One, we think of a category that's contagious. And so that means that type, if a cow is infected with, a good example would be Staph aureus, then those cows can infect other cows. And so when we think about managing that, we want to diagnose those cows that have contagious mastitis and identify them, because we're going to treat them differently than cows that have what we call environmental mastitis. And environmental means they just picked it up from somewhere in the environment. It's probably a type of bacteria that's everywhere in the environment, and so we're not as worried about those cows causing more. It's more the environment that caused that type of mastitis. And so for environmental mastitis, we'll see E. coli or Klebsiella, which are just different types of bacteria.
And the Klebsiella usually, they always taught us like bedding and
yep. And
things like
anything environmental, then you start thinking about what's in that cow's environment, both in the barn, in the free stall, or wherever she's laying all the time, but also you start thinking about milking procedure. Are we contaminating something in the process there?
Cool. And then when you're talking about the infectious, these things can spread through a barn.
Yep, and especially and this is maybe one reason that we see mastitis more in dairy cows, is that you can also spread them during the milking process. So with those infectious cows, then it's really important to look at your parlor management and your milking procedure and how you're cleaning those teats and how you're handling them and how you're cleaning your milking equipment and when you're milking those cows, because that'll make a really big difference in how much that bacteria is going to spread to another cow.
And when we start thinking about the beef operations, it's generally going to be more the environmental, when we get in that wet, sloppy time of the year. If we're having scours, we probably are having mastitis and we don't know, just environmental contamination.
And the difference with the beef is, for the most part, we have those renegade calves, but for the most part, you've only got one calf on one cow, and so there's not as much distribution between cows, or not as good of a way for those pathogens, those contagious pathogens, to go between cows. Gotcha.
So when we're talking about the contagious organisms, staphs,
there's strep. Certain types of staphs and streps are contagious, and then other types of staph and strep are not.
And mycoplasma?
Mycoplasma can be. And mycoplasma is almost the difference that we were talking between a little crawly beetle and this type of beetle, right? Those bacteria are really, really different. So when we think about management, we're going to manage those differently.
And when we have mycoplasma and respiratory disease, my dad has always said, mycoplasma is a bug looking for a disease. We act like it's something new. Yeah. It's been around since Moby Dick was a minnow.
Absolutely.
And now, because we're effectively controlling some of the other pathogens, we're seeing these pop up.
Sure, and we have different ways of detection than we used to. So we're seeing that with some other things. So there's actually one of the more recent things that we've noticed is there's some organisms that are not bacteria that actually cause mastitis. So one of those is called Prototheca, and it's actually an algae. And so it's not a bacteria even at all, but it does cause mastitis.
Cool. Well, we're going to take a break, folks. More with Dr. Schrog after these messages.
No matter where, no matter why, the Veterinary Health Center at Kansas State University is committed to providing quality patient care to animals and exceptional customer service to their owners. From routine checkups to emergency and specialty care, our world-renowned specialists and experienced professionals are here to discover, to teach, and to heal.
Let us know.
How can I help?
How can we help?
Sure Crop Fertilizers was started by my father, Don Sherman, and my mother, Shirley Sherman. Family business that started in the 80s. We predominantly focus on plant nutrients and what we can do to give growers better responses with the fertilizer dollars that they do, and what we can do to make those things work better for the grower. We're based out of Seneca, Kansas. We work with growers in their soil analysis to figure out what they need, and then we can put those in a blend that gives them the best results, and so that we can deliver that direct to their farm so that they have those nutrients where they need them, when they need them, and so that they can apply them in a manner that's very efficient to them and works well in their planting systems and what they're doing. Sure Crop Fertilizers has been around for a long time. We always say we're big enough to take care of everything you need, but yet we're small enough to do it quickly. You can get a hold of us at 1-800-635-4743. Our website is surecropfertilizers.com, and you can always email me at Corey@surecropfertilizers.com, and with any questions you have, we're glad to answer it and work with you.
Healthy cows start with the new hired hand automatic livestock sprayer. Rancher invented to provide an efficient alternative to pour-on and injectable parasite management systems. The portable design allows cattle to treat themselves head to hoof. Strategic device placement with pass-through activation technology takes the stress out of parasite treatment for cattle and the rancher, leaving more time to tend to other vital tasks on the farm. To learn more, visit cowsprayer.com. The new hired hand makes healthy cows easy.
Did you know long-range planning through the checkoff can help keep your business profitable? To successfully pass on cattle operations from one generation to the next, it's important to promote beef and keep farms and ranches profitable. Your beef checkoff helps do that.
We're Durger's Cattle Company, cow-calf operation primarily with a small replacement heifer operation. We started our operation in 2012, but we expanded on my father-in-law's operation, who started in the 70s, and built off his expertise and his knowledge and have taken and grown it to what it is today. We span about 4 different counties in North and South Carolina, running about 1,000 acres with 350 roughly head of mama cows. My husband and I and my son and my father-in-law operate together. About 2 years ago, we decided to make the switch to become all-natural producers. And what that means is it's a certain standard of quality and life for not only the calves that become part of the food source and the meat itself, but the cows also. Beef checkoff is important for our operation in a twofold way. First is marketing, creating a customer for us. We sell directly to feedlots, but our end game is the consumer. We want to create a product for the consumer that they desire, that they want to go back to the supermarket or steakhouse and they want more beef. Everybody knows the slogan, beef is what's for dinner, but it falls even more than that in that they've raised consumer awareness in quality, which is important to us because we try to focus heavily on our genetics. That's a main component of our operation, and the checkoff has allowed us to do that by promoting a product that's important to the consumer, that it's good quality, it's safe, it's nutritious, and they're gonna want to be return customers.
Hi, I'm Kim Mandarin with Hardy Insurance. I'm here to help you with all of your farm and ranch needs. When it comes to protecting your operation and your family, you need a name you can trust at a price you can afford. Call me today or visit hardyaviationins.com.
This segment brought to you by Kansas Soybean Commission. Progress powered by Kansas farmers.
Hey folks, welcome back to DocTalk. Dr. Dan Thompson here with Dr. Nora Schrog, and we're at Kansas State University where Dr. Schrog is a veterinarian. She has been associated in veterinary practice here at Kansas State University in our field services. She's been in practice in Nebraska, Paraguay, many different places. Pretty cool background and a pretty cool person and an outstanding veterinarian. We're talking about mastitis. So tell me how we diagnose it.
So we talked a little bit in the beginning about how we might just be able to look at the milk and tell, and so that's one way.
That's generally how.
Yeah, I mean that's the most common way.
Right.
But we can get a lot more sophisticated than that. And so one thing we might do is if we notice that our somatic cell count or our milk quality is not what we want, we could go look for those cows that are subclinical, so that their milk looks normal, but they're actually producing a large number of cells. And so we have some kind of old methods of doing that. One would be a California mastitis test, where we mix the milk with a little chemical that makes it clump up, and then we can see that it's not good. But some of the newer methods we have actually allow us to diagnose those cows based on what pathogen they have, and it lets us do it really quickly. So we can do it both. We can check that milk on the farm with you can just order little Petri dishes. You can get them in both in 2 or 3 sections, and then you take the milk and you smear it on there and let it grow for 24 hours. You can come back and look at that plate right before you want to treat that cow tomorrow, and you can tell, was that a contagious pathogen, or was it more of a gram negative, which we didn't talk about those much, or a gram positive, and we're going to treat all of those a little differently. So we can do an on-farm culture and have a really good idea which drug we might want to use or how we might want to manage that cow.
That's pretty cool. So the old California mastitis test will tell me whether we have mastitis or not.
Yep.
And now we have a test that'll differentiate and tell me which bacteria is actually causing the mastitis right there on the dairy.
Yeah, and really quickly. And so the one important thing to think about is this is when we can go back to our classifications and our clinical signs. That really matters because we do have to wait 24 hours. So that sick cow, we're not going to wait to treat her. We're just going to treat her with what we think is most likely going to work, and we're not going to wait for the bug to grow, because if we give her that much time, then she might not get over it. But for those mild and moderate cases, we've done quite a bit of work that says our effective treatment is the same, whether we wait 24 hours or not. And a lot of times we can save the dairy producer quite a bit of money by not actually treating at all, because we know our treatment's not going to work on one of those E. coli's or gram negatives.
So we wait until we get the diagnosis, then we decide how we're going to treat that animal. But like you're saying, and it all goes back into there's a good clinical diagnosis combined with the diagnostics to get to your treatment, and all of this then rolls right into what you've studied and what you are promoting on judicious antimicrobial usage.
Sure. And judicious use is always about, number one, doing everything you can to prevent it. So keeping those cows clean, doing everything you can in the parlor to manage that process and make sure everything's right. It always starts with prevention, but then after that, then getting your diagnosis right, then you can really be judicious about where antibiotics is going to do us some good and where it's not.
It's awesome. We're going to take a break. When we come back, we're going to wrap up with mastitis with Dr. Nora Schrog.
Are your cows practical or profitable? If you want them to be both, come to the Dale Banks Angus Bull Sale Saturday, November 17th near Eureka, Kansas, selling 140 yearling and coming 2-year-olds who have spent their days on the rugged pastures of the Flint Hills. For 114 years, the Perriers have been focused on providing hard-working, balanced trait bulls for progressive cattlemen nationwide. Make plans to join us November 17th or pre-register to bid online. For more information and to view our catalog, visit www.dalebanks.com.
Roxanne Struve, veterinarian in Western Iowa. I have a veterinary clinic and started doing stem cell therapy on dogs in August of 2014. And after the first 2 dogs, after 3 weeks, I saw such dramatic results. I said, hey, I have arthritis. I have joints, really need this help. Where can I go to get this done? I had stem cell therapy done in November of 2014 on my finger joints, my hip, and the ball of my left foot, all of which I'd had real severe problems with. Saw a pretty dramatic improvement in a short amount of time. I would certainly recommend that somebody don't wait until I'm in the position that I was in with the damage already done to my joints. I encourage veterinarians to use it for their animals, and I encourage anybody who sees this video, if you have need, get in contact with these people, because this is a phenomenal place to have this done.
Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
Valley Vet Supply.
This segment brought to you by Kansas Farm Bureau, the voice of agriculture. To join today or more information, go to kfb.org or find us on Facebook or Twitter.
Hey folks, welcome back to DocTalk. Dr. Dan Thompson here with my friend and colleague, Dr. Nora Schrog. And we are talking about mastitis in dairy cows and beef cows, and I really think it's cool. We got to get this way for respiratory disease next. That'd be fun.
Well, for everything.
Yeah, for everything. But so now, once you have that diagnosis, talk to me a little bit. Obviously, we recommend that everybody works with their local practitioner or their veterinary consultant or whatever it is that who they're working with on their veterinary client-patient relationship. But now talk to me about treatments and prevention.
Sure. So I do want to reiterate that, because not every farm is the same. There's going to be some farms where this diagnosing it on the farm makes a whole lot of sense, and some farms where maybe there's some other management factors that might be better. So it is important to keep that in mind.
You bet.
But in some places we've seen, well, first of all, in order to do on-farm culture, it's not it's easy to do, but you have to have somebody to do it. You have to have somebody that wants to do it and wants to pay attention to the details and learn how and do the quality control. So that's one thing that you have to commit to if you're going to do that. The other thing is, if we're doing on-farm culture, one of the main things that's good for is getting rid of those cows that are contagious. And so that can be one of the helpful things. This cow is the second time around. We want to make sure, she looks contagious. We're going to get rid of her. But that on-farm culture really helps you, first of all, get rid of the contagious cows, and then second of all, decide, okay, these cows are infected with something that my antimicrobial or antibiotic will work on, and these cows are infected with something that it won't. And so then when we treat cows, we really have, a lot of times we'll treat them intramammally, so we're not going to inject the whole cow, and then it depends on the drug. So just like we've got differences in our antibiotics, or just like we've got differences in our bacteria, we've got differences in our antibiotics. So
then we're going to match.
One.
Yeah, you're going to match up the antibiotic with the bacteria.
Yep, absolutely. And
so you said intramammary, and so if I treat one quarter, it's not the same as treating all four, or do they communicate?
So that's a really good question. There's a really long, complicated answer to that. The short answer is they are connected because they're part of the same cow. There's variability in how much they connect. So it is true that if I put antibiotic into this quarter, depending on the drug, some drugs are going to absorb extensively into the tissue and into the rest of the cow, and some drugs are going to really pretty much sit in that quarter.
Gotcha.
And so it's really, really drug dependent.
Gotcha. Okay, so once you pick the drug and the route of administration, now we're going to treat her, but then we're also going to keep track of her in the herd, right? So the difference between her having it the first time and her having it again, that's going to make us maybe less patient with her. If she's a repeater, then we want to get her out of the herd. Yep.
Right? So there's just all kinds of management factors that weigh into that.
Cool. Well, I wish we could keep going, but you have overloaded the system. My brain is fried, and I'm thinking about how I'm going to do this in feedlots now.
Okay.
But thank you so much for being on the show, folks. Dr. Nora Schrog, outstanding veterinarian here at Kansas State University. Very thankful for her to take the time and bring her bug and beetle with her today. Thanks for watching DocTalk. Remember, always work with your local veterinarian, and if you want to find out what we do here on DocTalk, you can find us on the web at www.doctalktv.com. I'm Dr. Dan Thompson with Dr. Nora Schrog, and we'll see you down the road.
Closed captioning brought to you by Ag Promo Source. Together we grow. Learn more at agpromosource.com.